Foundation has been in Kenya from 2014, and if you look at the investments we have been doing in Kenya, they have been strategic to the point that we focus on what we call interventions that can be sustainable beyond the funding we are providing. We invest basically in building capacity of healthcare providers. We invest in supporting facilities to be able to provide what we call routine care. So far in Kenya, we have established 11 treatment centers across the public, which is about 23% of the counties covered. We are looking forward to doing more. Probably by the end of the year, we are hoping we should be able to cover about 30% of the counties. We have trained about 11 Fistula surgeons who are supporting and providing treatment. We keep on building the capacity of CHPs to continue mobilizing, and we hope through these interventions we will continue to reach more women and support them to get treatment.
We are sincerely grateful to the Ministry of Health, UN, FPA, AMREF, the Fistula Foundation, flying doctors, and all partners for supporting Fistula. Treatment camps across this. These camps have provided free surgical repairs and medical care to women who have often suffered in silence and shame for years. As a county, we reaffirm our strong commitment to expanding access to quality Fistula treatment, embracing routine Fistula screening and treatment, training our medical personnel in specialized care, ensuring that no woman is left behind.
In 5 years, the ministry has conducted over 5,000 Fistula surgeries together with our partners. We have also intensified community sensitization campaigns, which have been led by the Ministry of Health and also in collaboration with our partners, such as the UNFPA, AMREF, and the Fistula Foundation. This has helped to reduce stigma, as we have seen here today, and encourage early health-seeking behavior among our women. Also, the ministry has improved capacity at health facilities, as we've known and as we've heard from the Fistula Foundation, like the Makueni County Teaching and Referral Hospital, which are now equipped to provide routine, basic, and comprehensive obstetric care services, including fistula repair, which we are hoping that now Kisii Teaching and Referral Hospital will be able to take up also on this. Here today, we are also launching the Fistula Surgeons Training Manual, and this initiative will ensure consistency in clinical practice, promote quality care, and ultimately contribute to the elimination of obstetric fistula in Kenya. The Ministry of Health is also proud to officially launch the obstetric fistula as a strategic user-friendly guide developed to support counties in effectively delivering routine obstetric fistula prevention, treatment, and post-operative care services. By aligning with the national health policies and leveraging existing county health system, the playbook empowers health managers and providers to strengthen service delivery models for fistula prevention and repair, enhance early detection and referral mechanisms, improve community awareness and reduce stigma, and monitor and evaluate outcomes for continuous improvement.
I'm called Nelson Musa. I work for Fistula Foundation. Fistula Foundation is a US-based organization that implements programs across Africa and Asia. I think we are generally in about over 33 countries. In Kenya, Fistula Foundation started its operation in 2014 under a program we are calling Kenya Fistula Treatment Network. This program has several objectives. One of it has been to build a network of treatment facilities that are able to provide routine fistula care. Basically because we believe once a woman who has fistula is identified, they don't need to wait. They need to be referred immediately. So one of the objectives is to continuously support facilities to provide routine care. Currently in Kenya, we have about 11 treatment facilities. We have a treatment facility in Mombasa called Bomb Hospital. We have another facility in Kilifi called Wadadia Hospital. We have Jamaa Hospital in Nairobi. We are working with Garissa County Referral Hospital, Narok County Referral Hospital, Vihiga County Referral Hospital, Kapenguria, and we are also working with Kisii Gyno Care Hospital in Kisii here, and Eldoret Gyno Care and Women Hospital in Eldoret. Not forgetting in Kitale we also have Cherengani Nursing Home. So basically these are facilities that we support with fistula treatment care. In terms of treatment, we take care of the cost for patients. We support patients to get to this facility by providing transport to the facility and back home. Again, as I mentioned earlier, there should be no reason to why a woman should stay once they have been identified. Yeah, there should be no reason. If it is they don't have transport, we support with that. They can't afford the cost, we support with that. Making sure after treatment, we also have a program where the facility and our partners in the network follow up on these patients to ensure they receive what we are calling after treatment care. Again, to increase access to treatment, we also focus on training healthcare providers. We train fistula surgeons and we train nurses. Currently in the country, we have trained about 11 fistula surgeons, of course operating across our treatment facilities. We have trained over 75 nurses on fistula management and care. We have supported county government in sensitizing healthcare providers in facilities with a significant number. We are also building the capacity of, we call them community health volunteers or community health providers. They are also called community health workers. I mean, there are various terms that are used. And in that context, we work with, like in Kisii, we have Daraja Mbili, who is an outreach partner. So through Daraja Mbili and working with the ministry, we have been able to capacity build over 360 health providers, healthcare providers across the country. We have sensitized, I think we have trained CHPs in about 10 counties, and we have trained CHPs for our 6 treatment outreach partners in the country. The other thing we have been doing to increase access is, of course, working with the Ministry of Health. We have been part of the process of developing the fistula treatment, the fistula surgeons curriculum, which is currently now being experimented to be, I think, launched. We have also participated in designing CHV training manual for CHVs. And all these efforts are meant actually to increase access to care, ensure women are found at the community level. These women are referred to the facility and they're able to receive treatment. Looking into the future, we want to continue to expand the number of treatment facilities. Currently, we are hoping by the end of this year, we should be able to have added 4 treatment facilities that will be providing routine care. Ideally, we have realized, like in the northeastern, we have not done much. So we are focused on training a fistula surgeon for Turkana County. We are also training a fistula surgeon for Mandera County. And we are looking forward to creating partnership with Makueni County and Busia counties, just as part of expanding the... within our program, we have what we call structured post-repair follow-up. Partly what we do, we have the outreach partners and even the treatment facility. We will encourage them to follow up on the patients 2 to 4 weeks after treatment, 3 months after treatment, 6 months, and 12 months after treatment. And partly when they are following up on the patients is to make assessment on some of those social, economic, and psychological issues. And preferably, once those patients are identified, they are able to be linked to opportunities in the community for them to access support. That is what we do as a program. In the past, we had a reintegration program where we used to support training of women, those who want to engage in income-generating activities. But unfortunately, again, because of limited resources, we ended up reducing the budget in that direction. Again, from the speech, you had the guest speaker saying, in terms of data, it's very difficult. We don't have clear data on how fistula affects women. We generally just have the number we anticipate could be developing fistula yearly. And of course, he mentioned about 3,000 women yearly developing fistula. But in terms of distribution in the country, that's not very clear because we don't have that data. It's not clear. You asked a question, and again, because we do not have very clear ways of getting data, it will be difficult for me to answer that. But ordinarily, I will tell you, as Fistula Foundation, from the time we started treatment, we used to think that after 10 years, we will begin to see a decline. But I'll tell you, we continuously see an increment year after year. From 2014 up to now, up to last year, December, we had treated about, up to March, we had conducted over 16,000 procedures. And every year we see an increment. So it's difficult to say they're reducing. Yeah.
So do you mean there's no research that has not been done, or what is it like?
Yeah, we don't have. Of course, for you to have clear data, you need to do some bit of either survey